The short history of kind of the Air Force experience was that in the 94-95 time frame, you have the Chief of Staff of the Air Force, who's a missile officer, sitting there seeing the death reports coming over his desk day by day. And he had this sense that they were coming more and more frequently. So it wasn't epidemiologists telling him, hey, you know, we've got these increasing rates. He detected it himself by daily suicide reports coming across his desk. So then he asked the epidemiologists to look at it. And lo and behold, you know, General, you're right. The rates are going up. And so then, you know, Admiral Borda took his life, you know, a close acquaintance of the Air Force Chief of Staff, and he said, we've got to do something. So we pulled the whole community together. We pulled every stakeholder we could think of in the community. Commanders, law enforcement, the attorneys, you know, the death benefits folks, personnelists, everyone that we could think of, including, you know, the medics, mental health and so on, and said, what is this problem? What does it look like for us? How can we understand this? So where there were data, we looked at the data. Where there were none, we took kind of the informed, you know, key informants in the community to say, what does this look like to you? So we got our hands around the problem, and then we said, okay, what are the solutions to this problem? What are the aspects of it that we can understand, and what are the solutions? And we ended up with a 12-element program. We went to the Chief of Staff, said, this is what we think we should do. He said, do it. No money, but, you know, we've got all the resources of this community in terms of people, policy, and so on, and make it happen. So we did it. When we started this, the suicide rate was, we were having about 1 suicide a week. And, you know, after about 3 years of declining rates, we actually went for one period, I think it was 182 days without a single suicide. So, you know, as we were sitting there at the headquarters, you know, every day waiting for the next suicide report to come in, you know, just, you know, day after day after day went by without a report. It was quite a phenomenal experience. When we started this, we could never have foreseen where it was going to go. And now, 17 years later, to see that the ripples are still going, and it's really, perhaps still the only time where we've taken a big population, until Henry Ford, a big population, and through a public health type of intervention, dramatically dropped the suicide rate. It happened because a lot of smart people got in the room together and collaborated, not competing with one another, but trying to figure out something and trying to do the right thing. Where do I hope it goes? You know, again, I just hope that we will just be able to replicate that in more and more health systems, because I think that there, as Henry Ford health system showed, there's a potential to have the same kind of effect in this healthcare setting with patients that we know who they are, we can follow them, we know a lot about them, and therefore we should be able to bring interventions to bear to increase protective factors in their lives and decrease risk factors. I think this zero suicide piece, you know, getting more and more health systems to figure out, and this is kind of linked in also with healthcare reform, as we have accountable care organizations and health homes and some of these, you know, other new entities that are coming into play with healthcare reform, that they're going to discover that, oh, gee, if you take care of people who are at risk for suicide, that you're going to reduce hospitalizations, you're going to improve their health, and you're going to save a lot of money. So that will start driving the whole healthcare market. There's no goal that you can go after other than zero. There's no acceptable level of suicide. So let's just say we're going to zero. Now, we're not going to be disappointed if we only cut it 50%, right? But if we get down 50% below where we are now, then we're going to go for 40, and then we're going to go for 30. So the goal is zero. We don't expect to be there next week or next month or next year, but we're heading to zero. You know, I think we're making real inroads among people in the workplace. Mobilizing supervisors, giving tools to managers and to leaders and to CEOs to prevent suicides among their workforce and building that case, which has been hard to do up to this point. Even though the majority of suicides occur in working age adults, it's been hard to build a case that employers should invest in preventing suicides. And so, we're learning how to package that along with just increasing wellness in their workforce, which is going to pay dividends. Big achievements, of course, are a revised national strategy. So that's a piece of infrastructure now that we have that will carry us through another decade or so. We're about to have the first ever prioritized research agenda. So for the last decades of research, we've been funding good ideas wherever they come up. And for the first time, we're going to be able to put the money, the limited resources, where we think it's going to produce the biggest results. So that, in 2 years, 3 years, 4 years, we should expect some real breakthroughs because the research is going right where we need it. We're about to come out with the first guidelines for training for health service providers across the whole spectrum. So tailored guidelines for each professional group. This is what they ought to know how to do in order to prevent suicides in our society. We're making inroads with the media. So for the first time, the Associated Press has guidelines for a style guide for mental health issues. And we'll work that on the suicide piece as well. Almost, I would say weekly, I hear about something that has happened to advance the national strategy because of relationships that have occurred around the many tables of the National Action Alliance for Suicide Prevention. There's no way to value that, to put a dollar value on that. But it is, I'm convinced, it's significantly advancing the suicide prevention effort in this country. It's a movement that just continues to gain momentum. I think they should be thinking about accountability so that they are really watching the end game. They're watching suicides, and from every suicide, they're trying to learn and improve what they're doing. The second piece that they should be concentrating on is institutionalizing these things. Get it in written policies that can't go away when someone leaves the company and someone new comes in. So as much as possible, get this encoded in the company's laws so it has staying power.